So at this time, I have the pleasure of introducing Ambassador Deborah Birx, who is an innovator problem solver using her global experience in big data for action. She has extensive experience in the development of diagnostics, therapeutics, and vaccines for improved health, disease prevention, and health security. She was the past White House coronavirus coordinator, and she currently is an independent board director of NanoLive Corporation. Dr. Birx, the floor is yours.
Thank you. It's so good to see you, Kevin, and your team, and have people on late at night. For me, it's easy. I'm on the West Coast right now, so it's not late yet. So really appreciate the opportunity. I couldn't start the presentation though without talking about these H5N1 cases. There's a recent upload on the CDC website that summarizes all human avian flu cases since 1997, which I thought was just really lovely and well done. I've got calls into Egypt right now to see what they did during this spike that they had back in 2015. But right now, except for Egypt, the US in 2024 had more human cases than any other country previously that had been tracking avian flu cases. So I think, to me, I feel like we have a great evidence base. And you can see there was only one prior case in the US ever since 1997. There was one case in 2023. So I think, to me, this is really a very important place to start. When we talk about pandemic, I think there is a change. I think this is the longest time we have gone in the United States with having continuous avian flu in our livestock in a way that we've never had in the past. So there's certainly a difference. And I feel like we're not testing those that are at the front line, because remember, once you didn't prevent, the number one thing you can do is detect. And we continue to only look for symptomatic cases. So when the CDC says that we have 770 plus exposures, they're following them only for symptoms. There's no proactive testing to actually test asymptomatic individuals to see how much human transmission there is. This was done, I think, in Minnesota or Wisconsin, and they found for every case that was detected about 10 asymptomatic, or you could call them subclinical cases, that hadn't been found. And then, of course, the CDC just did that with the veterinarians and found 2 veterinarians that had been previously infected, no symptoms. And so even though we have 14,000 people who have been exposed, we've only tested 770. And therefore, we've only detected 64 cases. So I think part of pandemics, like we do with Ebola or Zika, you test in the area of threat. And so if the dairies are the primary threat area right now, and certainly if you're a dairy worker, your exposure to cows is much higher than poultry workers' exposure to poultry. They are often on automatic feeders and waterers. So just something to keep in the back of the mind. And of course, this is our hospitalization of this year of our respiratory fall. We had a huge and late COVID surge that went well into October. So because natural immunity and vaccine immunity wanes about every 4 to 6 months, we are set up to have COVID probably late spring. But I just wanted you to see the flu cases that are out there. There's a significant second surge, and it's due to H3N2. So still quite significant in the United States. Really appreciate your time. And of course, we'll take any questions